Okay, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, good morning, and thank you for joining us again today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, I'm happy to be able to share some good news today. News that the decline in Ohio's COVID-19 cases, a decline that we've seen over the last few weeks, has in fact continued. And in some areas of the state, that decline has even accelerated. Just a month ago, Cuyahoga County had a rate of 3,000 cases per 100,000 residents. That number has now plummeted to 189 cases per 100,000 residents, a sharp and welcome drop. The number of people hospitalized with COVID-19 also continues to decline. Ohio saw a peak of over 6,700 people in the hospital on January 11th. As of yesterday, that number has gone down by more than half to just over 2,800. Significantly, just in the last week alone, the state's hospitalization numbers have declined by 18%, a further sign that the Omicron wave is in fact receding about as quickly as it arose. Now, just about every region of Ohio is experiencing this drop in cases and hospitalizations, although parts of southern Ohio, where Omicron peaked much later than in the Northeast, haven't yet seen as sharp a decline. The drop in hospitalizations has allowed more hospital systems to resume a full scope of services, including performing elective surgeries, which many hospitals had to suspend for a time during the Omicron surge as it taxed their resources, especially their human resources. As the pressure on hospital staff is easing in more areas of the state, this has allowed some of our National Guard members who stepped up at a crucial moment to provide essential support to our hospitals to head back home and back to their regular occupations. At the peak of Omicron, about 2,000 Guard members were deployed at 62 hospitals and 18 testing sites all around our state. This has been an extraordinary intervention and one that's made a big difference for so many hospitals and the communities that they serve, including reducing pressure on our vital emergency departments. As of Tuesday, the number of Guard members deployed across Ohio had declined to about 1,200, serving at 28 hospitals and 13 testing centers. But while the National Guard may be reducing its presence in our hospitals and our testing centers, it's certainly not the time for us to let our guard down. Although our case numbers have in fact substantially improved from our Omicron peak, it's important to put our current numbers into some perspective, remembering that a case rate of 100 per 100,000 people is considered high. Ohio's overall case rate remains at more than 5 times that number, and our highest counties are in fact still close to 20 times that benchmark. So while there's no doubt we are quickly moving in the right direction, it's simply too early for us to declare victory, given the reality that thousands of Ohioans are still being diagnosed with COVID-19 each and every day. In the meantime, we need to remember that we have many important tools at our disposal to protect ourselves, our loved ones, and our communities, as there remains a lot of virus out there in the community. Wearing a mask, particularly in many crowded indoor environments, may still be a wise choice. And of course, getting vaccinated remains the very best way to safely minimize your risk of developing a serious illness related to COVID-19. Getting vaccinated also means that you'll join more than 60% of eligible Ohioans, those ages 5 and older, who have now also been fully vaccinated. That's a number of more than 6.6 million people. But while getting your primary vaccination series is a great step to protect your health, it's not the final step. As with many other vaccinations, keeping your protection against COVID-19 up to date includes getting a booster shot when that's needed. As we transition from living through a COVID-19 pandemic to something we're better able to live with safely, getting a booster shot on time is an important part of keeping our immunity strong. Indeed, the Centers for Disease Control and Prevention, in looking at experience with the Delta and the Omicron surges, has reported that people who got their booster when it was time were in the best protected position against illness resulting in hospitalization. And staying up to date with a COVID-19 booster really appears to be particularly important for those who are over 40 or have certain underlying health conditions. Today, of the 6.6 million Ohioans who are in fact fully vaccinated, nearly 3.3 million have received a booster, which is good news. But it also means that there are millions more of us who might still be eligible to receive a booster. Joining us now to share further insights on vaccinations and boosters is Dr. Steve Gordon, Chair of Infectious Disease at the Cleveland Clinic. Dr. Gordon, Ohio, of course, experienced record-setting hospitalizations during this recent Omicron wave. What did Omicron teach us about the importance of staying up to date on our vaccinations?
Well, thank you, Dr. Vanderhoff. It's a pleasure to be here. If I can just start with a note of gratitude to you in particular. I know you've been in this position since August, but I just want to recognize your leadership, just your perseverance and your equanimitas, for which we are all grateful. Now, back to your question, I think all of us understand that COVID vaccination has been a critical tool in helping to mitigate the burden of hospitalizations throughout the pandemic. And as you mentioned, Omicron was different. Omicron really blew through here so very quickly, and there was tremendous numbers of infections, even including those that I would say are spike exposed, that is prior vaccinated or prior COVID. But having said that, what we learned and what CDC studies and others have shown is that compared to those who are not vaccinated, being fully vaccinated or boosted was significantly associated with less hospitalizations, and if hospitalized, less severe disease. And for those greater than 65, importantly, less deaths. And these are the important metrics now that I think that we all focus on, not so much breakthrough infections, but really severe disease. And to your point, emphasizing the boosting now to be fully up to date is something that we know that can help protect you, especially with the Omicron surge.
Dr. Gordon, let's take that concept of the spike exposed just a little bit further. So many people have now, in fact, been infected with COVID that they may be wondering about how well past infections are going to protect them against future illness, particularly when we're thinking about COVID being with us for the long run. How should that influence their decision-making about vaccination, and how can they think about the potential benefit that vaccination may still offer them?
It's a great question. I think I would start by saying both natural immunity as well as vaccine-induced immunity does provide protection against illness, and that's really what we're paying for. What isn't known is, of course, the durability of that for either. But as you mentioned, vaccine-induced immunity is the safest way and most dependable way to acquire that in this regard. But having said that, we don't want to ignore the fact that it's now estimated perhaps 80% of people in the homeland have been, quote unquote, spike exposed with Omicron. And so there are some underlying questions in terms of when would be the next, when is the best way to move forward? CDC, as you mentioned, still recommends everyone, regardless whether you had COVID or not, to be vaccinated and up to date. I would say that if you look now, and we just completed, my colleague here, Navin Shrestha, looked at our healthcare workers during the Omicron surge. We looked at both people with prior COVID and both that were fully vaccinated. And again, this study showed those that got boosted, that is, whether you had prior infection or whether you had, quote unquote, the 2 doses, the primary series, did provide significant protection against infection. So I do believe that with the waning immunity, that both camps, there is a role, as you said, for boosting. I think what is going to be determined as we move forward will be what is the circulating virus and what that interval will be. And as you also mentioned, CDC just updated their guidance for boosting for the immunocompromised, that should be accelerated to at least 3 months as opposed to 5 months for others.
Yeah, thank you for that. You know, the last thing I ask you to hit on, and your comments so far have touched on this a little bit, but you know, we've been through a lot of ups and downs with this virus, and we've seen various variants roll our way. And I think that there is every reason to expect that there will be another variant that will roll our way. But it has become increasingly clear just how important the role of immunity is in changing the dynamics of even dealing with a difficult or highly contagious variant. What does that all tell you as an infectious disease doctor as you look ahead to the future and we think about a population like Ohio that is around 60% fully vaccinated? If you look at people who have started, we're above 65%. Where's that headed? And as a doctor, what's your best advice to a patient coming to you and saying, should I or shouldn't I get vaccinated?
No, great questions. You know, Bruce, as I think as we evolve into what we call endemicity, which I define as more permanence, you know, there isn't going to be, in my opinion, one marker that's going to say that we are there. This is going to be a process. And as you know, it's a political process. It's not science will help, but these are going to be policies made. And in my opinion, I'm not predicting here, but I think what we've learned about is preparing for the next. We know that Omicron or coronavirus is not going to go away. We know that there's non-human sources. I mean, people have heard about the deer in New York City. There's postulation that it might be in the rats. But I think we've gotten smarter and innovative, and you take a lot of credit. So if I look at Ohio surveillance, as you know, we're doing wastewater sewage surveillance. I think we have more sites than almost any other state. That, as you've taught us, is a leading indicator as opposed to a lagging indicator, and will be another early warning system. And most households are hooked up to that, doesn't require access to testing, as well as, I would think, pushing testing out into the households that's been done, continually to educate Americans on the pros and cons of these, as well as treatment. So I don't want to get into the prediction mode, but I do think you and your team have set us up for preparedness mode for what comes next. We will be better prepared to help save more lives and hopefully preserve the health and wellness of all the Ohioans.
Terrific. Thank you so much, Dr. Gordon. COVID-19 vaccines for children younger than 5 years of age will soon be evaluated by the FDA Advisory Committee. And if the FDA subsequently authorizes vaccination for those children 6 months to age 5, the CDC and its Advisory Committee on Immunization Practices could well make vaccines available for this age group soon thereafter. We, of course, anticipate that there will be robust conversation among the nation's top experts on immunization when they meet over the next several weeks, particularly as they're reviewing safety and effectiveness of the vaccine for this youngest age group in the face of continuing trials for what could be yet a third dose for that population. So with this all as background, and to ensure our readiness right here in Ohio in the event of approval, the Ohio Department of Health is currently working with more than 3,800 vaccine providers all across the state. That includes pediatricians, family doctors, local health departments, adult and children's hospitals, pharmacies, to prepare to vaccinate this youngest group of our children to date once those vaccines are available. Now, well, there's no doubt that children are generally less likely than adults to become severely ill with COVID-19. We need to remember that they most certainly can, and unfortunately do, become ill, even seriously ill, and can suffer lasting complications from the virus. In fact, Ohio's children's hospitals also reported significant surges in hospitalizations for children with COVID-19 during our most recent Omicron wave. And just as with the adults, these cases sadly were also largely among those who were not vaccinated. Joining us next to discuss the importance of vaccination and boosters for our children is Dr. Sara Bode, a primary care pediatrician and medical director of Nationwide Children's Hospitals Care Connection School-Based Health and Mobile Clinics. Dr. Bode, one of our most frequently asked questions is, why vaccinate young children if their risk of serious illness is low? How do you help your parents of your patients think through that really important question?
Yeah, thank you, Dr. Vanderhoff, for having me. A couple of talking points with parents, I think, that are pretty important, some of which you highlighted already. Although the risk of serious illness in kids is lower than it is in adults, it's not zero. And we are seeing kids that are getting hospitalized every week in our local hospitals in the state of Ohio with that serious illness. And as you mentioned, that is occurring almost exclusively in kids that are unvaccinated right now. So we do see that just like in adults, even in our pediatric patients, so in our children that are ages 5 to 18 now, they are highly protected against hospitalization if they are vaccinated and boosted for those 12 and up. So we do know that the vaccine also works. The other thing to note is that when you are vaccinated, even if you do have a mild breakthrough infection, just like in adults and kids, that means that you're less likely to transmit the virus. So now not only are you protecting your child, but you're also taking a step towards protecting everyone in the family too, and everyone in your extended community. So many of our parents have young kids, but also have those children's grandparents that are around or other more high-risk individuals. So this is about protecting your child themselves and also your extended family at the same time.
Thank you, Dr. Bode. So as a pediatrician, and thinking ahead to the possible approval for this new age group by the FDA, what do you anticipate the potential impact might be of having a vaccine available for this younger age group, 6 months to 5 years, especially from the point of view of parents who are thinking about, is this the right decision for my child?
I think it's really important to consider a couple of things. The first is that, young children have now recently held a disproportionate burden of new infections to COVID-19 because they have not been able to get vaccinated. And even our pediatric patients that are vaccine eligible in the age group that have lower vaccination rates, we are seeing a higher, rate of infections. And so number one, it's really important for this vaccine to get approval so that we can allow families to provide that protection. Parents are making difficult decisions every day when they have to go to work and they're looking at early childhood education centers for their children as an example. They want to ensure that they're safe. And we know that we can create safe school environments and safe preschool environments for our kids. And we're doing the best we can, but adding vaccination as that mitigation strategy for that is going to really help us keep all these children where they need to be in these quality learning environments and allow parents to be continuing their lives, living through this pandemic and being able to get to work. So I think this is a really important step forward in our fight against COVID-19 and getting to the least restrictive environment we can so that everyone, is able to, again, go forward with what they need to do on their daily lives.
So thinking about this next population and thinking about pediatric vaccination, you have been at the forefront of the pediatric vaccination effort here in Ohio, and especially in Central Ohio with your role. What have been some of the biggest challenges with getting vaccines to kids? And what are you hearing from parents about their anxieties about vaccines that we could address now?
Well, I mean, of course, first, access is first and foremost. We have to find easy ways for families to be able to access the vaccine for their child and in a place that they find comfortable, that they're confident in the process. We have done a lot of great clinics at community centers, at schools, at places where kids and families, have that trusted relationship. And I think we're going to continue to offer those, and that's going to be really important. The other thing, I guess, just to talk with families and reassure them is that kids get vaccines a lot. Any parent with a young child knows that. And just like any other vaccine, kids just react remarkably well to the COVID-19 vaccine as well. So we've really seen minimal side effects from the vaccine. Additionally, I know there's a lot of anxiety in parents for the vaccine, but when we are actually approaching children with this vaccination process, it goes fairly smoothly. Really, there's minimal anxiety there. These are pediatric providers that give these vaccines, so they're so used to understanding how to calm and comfort and distract during this process. And it's really been pretty minimal, as far as having any adverse reactions or any just anxiety symptoms out of our kids. So I think for parents, it's really the understanding of finding a trusted place, making sure they have easy access to that during a time and day, whether that's evening or, during the school day or at their child care center, so that they can have the opportunity to get their child vaccinated quickly and effectively.
Thank you so much, Dr. Bode. The COVID-19 pandemic has certainly taken us down a long and winding road. Thankfully, there are now many encouraging signs of improvement, and we seem to be heading solidly in the right direction. As we move forward, in addition to vaccinations and safety measures like masks, healthcare providers across Ohio will have increased access to therapeutics as a tool to treat their patients at various stages of disease. Current treatments that we have available in very limited supplies include agents that you may have heard of already: sotrovimab, Paxlovid, molnupiravir. And there is a preventative for high-risk populations called Evusheld. Next week, the Ohio Department of Health will launch a new dashboard at coronavirus.ohio.gov that will help connect Ohioans and Ohio healthcare providers with locations offering these treatments and preventatives. The dashboard will include a map, it will be searchable, and it will be able to be filtered by city, county, and zip code. And that dashboard will be updated every week. It's important to note that these therapies require a prescription or an order from a licensed healthcare provider. So Ohioans seeking any of these treatments must first reach out to their healthcare provider to discuss what is the most appropriate treatment plan or options for their particular health situation. Prevention, of course, remains our most important line of defense as we continue this fight against COVID-19. And vaccination remains the foundation of our prevention efforts. Getting vaccinated against COVID-19 can, in fact, lower your risk of serious illness from COVID-19. And as Dr. Bode shared, it can also help reduce further spread of this virus. Staying up to date on vaccinations is the best way to prepare for the future as we prepare to live with COVID-19 for the long run. If you have questions about vaccination or getting a booster, we encourage you to talk to your physician or other healthcare provider and get your questions answered. And while I think we can all be very encouraged by the improving trends we're seeing all across the state, let's remember that our numbers in Ohio are really still quite high. And we need to be careful not to let our guard down too soon. Any parent who's taken the family on a long car trip is familiar with the question, are we there yet? Well, the answer is, We're getting closer, but we're just not there yet. Thank you. And now, Ken, I think we can go ahead and open it up for questions.
Okay, thank you, Dr. Vanderhoff. Our first question today comes from Dan DeRoos with WOIO.
Dr. Vanderhoff, again, thank you for the time. Good morning. The one number that doesn't seem to be dropping as rapidly is the daily hospital admission numbers, still continuing just about every day to be between 300 and 400. Why is that number not dropping as fast? And does it still hold that those individuals, is it still 85, 90, 95% unvaccinated, or has that changed?
Yeah, thank you. The great question. And as has been true throughout much of this pandemic, one of the things we need to recognize about hospitalization is that it's a lagging indicator. As you'll recall, when a person first becomes infected with COVID-19, it generally takes some time before their symptoms and their condition evolves to the point that they're sick enough that their care would warrant being in the hospital. So we can see a lag in the peak of hospital activity that can be as much as 2 to 3 weeks following whatever peak we see in terms of other measures, including the cases and the positive test numbers. So it's pretty evident to me as I'm looking through that data that's really what we're seeing in those hospital numbers as you've identified. Fortunately, we are seeing that the total burden of hospital bed occupancy in the state has now for well over a week been coming down very steadily. And it's clear to me, that's on a statewide level, but it's also clear to me as I look at the 3 zones of the state that we've seen now all 3 zones either hit their peak and begin the downturn, or in the case of the north and central regions, they've not only peaked, but they're coming down precipitously. So I think it's a matter of some time, but I'm encouraged that we're headed in the right direction.
And still the high percentage, still 90% unvaccinated?
Oh, yes. Thank you for, yes. So we are not seeing any change in terms of the vaccinated versus unvaccinated dynamics in the hospital. Our hospitalizations continue at all age brackets to be driven primarily by people who are unfortunately unvaccinated.
Our next question comes from Alexis Moberge with WSYX.
Hello, thank you so much for taking our questions.
Yes.
Vaccinating your kids, however, it seems like most of the kids, at least talking with some of our local hospitals who are hospitalized, have underlying conditions. What about healthy children? Is it necessary to still vaccinate healthy kids?
Excellent question. I'll kick it off and then turn over to Dr. Bode, since she is a pediatrician and a pediatrician who's focused a lot of her efforts on vaccination. Unfortunately, we're not always able to predict which of our children are in fact going to develop a serious illness with COVID-19, either requiring hospitalization or resulting in the post-inflammatory condition that we've talked about before, known as MISC. And too many of those children who have developed a either serious post-infection condition or have in fact needed to be in the hospital have unfortunately been kids that you wouldn't have predicted would require that. So from my point of view, I think vaccination for children remains a very important and vital option for parents. But Dr. Bode is much closer to this, and I'm going to turn to her to expand on my comments.
Yes, thank you. Well, I agree with everything you just mentioned. One really important point just to emphasize is that the vaccine is highly protective. Data is showing us against the development of MISC disease, which can occur in children with no underlying health conditions. So not only protective for maybe, acute hospitalization, but also some of those more concerning long-term effects that we might see in kids. So that's one important thing. The other is that younger kids, even without underlying health conditions, can often need hospitalization due to COVID-19 because of their respiratory status. So just like when we think about, for example, RSV virus and talking about our youngest kiddos and getting hospitalized because they're having some difficulty breathing in the acute period, that is also something that can occur in young children as well. So thinking about this new approval in the younger age group for COVID vaccine, that's another important consideration.
Thank you. And just real quick, if I could follow up, what about boosters? I mean, for children, is that something also, if for those healthy children, like I had mentioned, is it safe for kids 5 and up to get those boosters if they are healthy?
Dr. Bode, I'll let you jump right in there.
So again, we're providing vaccination to protect against this severe illness and infection rate with COVID-19. And just like in adults, what we know from the recent surge and with the Omicron variant, the booster dose is highly protective at continuing that immunity. So again, just like in adults, with kids, we would recommend that booster dose even in healthy children. And just as Dr. Vanderhoff had mentioned earlier, even in children that have had recent infection with COVID-19, we're still recommending that booster dose because, again, that natural immunity is not going to be as reliable or standardized or predictive as that vaccination to really offer that complete protection. So absolutely, we would recommend booster doses as well.
Okay, our next question will come from Spenser Hickey with Hannah News Service.
Thank you. Director, would you be able to give some insight into how well ODH has been able to receive self-reported COVID tests taken at home as far as the daily case numbers?
Yeah, thank you for that question. Of course, it's very hard for us as a Department of Health or any Department of Health in the country to know how many of these tests have been performed and not reported. However, I can tell you that we do get reports in. Generally speaking, when that occurs, it occurs through one of two mechanisms. Some of these tests, as you know, are proctored. They do offer an online proctoring option. And the company that provides the proctoring actually takes responsibility for getting those reports into the health department. So that's one mechanism. Another is that when people perform a home test that does not include a proctoring option, they have the opportunity to report their test into their local health department. And in many circumstances, those results are received and then added to our total. But we recognize that probably the vast majority of those home tests are in fact not being included in our totals. Having said that, nevertheless, we've got very clear trends that we've been able to follow. And we still have very substantial numbers of people who are completing the kinds of tests that we know we do get reports for, those that are proctored as well as those that are performed by hospital laboratories, local health departments, other testing sites, pharmacies, et cetera. So the volume of information that we have coming in is very significant. And it's really a matter of us looking at trends for testing. But that's what's useful and most important. The absolute number, I think, is much less important than the very clear trends.
Our next question comes from Pete Grieve with Spectrum News.
Hello. When it comes to the oral pills, molnupiravir and Paxlovid, are you seeing any hesitancy from patients around those pills? I was looking at some of the data that seems to show a lot of the hospitals have quite a bit of supply that hasn't been used yet, but I wasn't sure how reliable that federal data is.
Yeah. So no, we have not been having reports of a lot of hesitancy surrounding those. And I think that as we move forward, one of the things we're going to need to recognize is that a lot of these decisions, because these are medications that can have drug-drug interactions. These are medications that can have different effects depending on your underlying health and health conditions. It really does require a physician or healthcare provider's scrutiny in determining whether or not these medications are going to be safe and if they're likely to be effective. One of the things that doctors think about is the fact that for many of these medications, the data shows they work very early in the course of illness. So if it has been too many days from the onset of your symptoms, the medications may not work, et cetera. Medications, particularly the oral agent Paxlovid, appears to be very highly effective. It also, compared to molnupiravir, has many fewer side effects and drug-drug interactions. However, we have the benefit of having a very experienced infectious disease doctor on with us today. And so I think what I'll do is turn to my colleague and see if Dr. Gordon has more to add.
No, I agree with everything that you said, Dr. Vanderhoff. I would say, though, that this is linked to testing. So as mentioned, time sensitive. So I don't think we've broken that frictionless aspect, and it should be targeted for the highest risk. So I don't think we've worked that out. I can tell you at the clinic, there's not been a great uptake for some of the variety of reasons mentioned. Obviously, numbers are down, but also for the clinician, it can be a little overwhelming when you see some of the drug-drug interactions that may occur, especially with ritonavir. So I do think this is one of those great expectations, but it's faced with reality now, and it is something that we need to work out. But I also think that's the other thing to link it to the home testing, because I can look at a home test that's positive and act on that to begin to prescribe.
Our next question is from Joe Ingles with Ohio Public Radio and Television.
Good morning.
Hello, doctors. Thanks for doing this. We've received inquiries from a lot of businesses who say that, you know, the hospitals got all this help from the Ohio National Guard that they didn't have to pay for. And when they're reporting their earnings outcomes, they're showing a healthy bottom line, while other vital businesses in Ohio that have are needed and provide services have not been given any help from the National Guard and are not really getting much help from the state. They're questioning how the state picks winners and losers in this case. Can you address that, please?
Well, thank you for that question. As we look at this particular decision, I think it was a vital decision to deploy the National Guard to provide key support, mostly to emergency rooms and to testing sites. It was made at a time where it was clear that the volume of cases for COVID-19 was threatening to overwhelm the capabilities of our healthcare delivery system. And that, of course, could have a catastrophic impact. The decision to deploy to any given facility or any given hospital required that hospital had already taken extraordinary steps that, quite frankly, severely adversely impact their bottom line, including backing away from many routine procedures, including surgeries that could be postponed. That is a real financial burden to a hospital because at the end of the day, it's those procedures and surgeries that are often the foundation of their bottom line. So there had to be a step taken by the hospitals that indicated that things were severe enough that they had to actually back away from that in order to redeploy the best they could the staff they had. So this was a decision made to save lives. And as soon as the data began pointing toward institutions being in a position where they could resume taking up responsibility because they were now better able to resume other functions like routine procedures which are still vital for patient care, as I think we all know. The Guard then we rapidly redeployed the Guard either to other parts of the state or stood them down. And the numbers I shared earlier indicate how seriously we're taking the limited application of these added guard resources focused on saving lives and helping to prevent the healthcare delivery system from collapsing under the weight of this very severe surge. So I understand the concern. I understand the perspective that has been voiced, but I think I can also provide reassurance that this was a very targeted and, as we can tell, very time-limited deployment that focused entirely on life-saving.
Our next question is from Jordan Laird with the Dayton Daily News.
Good morning. Unvaccinated adults seem unmovable. Does ODH view getting all vaccinated Ohioans boosted and more kids vaccinated as the best path toward getting us more protection? And will that be enough to ward off any future surge, or do we need to convince the unvaccinated adults?
Well, I think, as we've shared earlier in our comments, we as medical professionals, as physicians, continue to be very confident that the foundation of protection, the safest bet that any of us can take in terms of reducing our personal risk of developing a severe case of COVID-19, is to get vaccinated and to keep our vaccination up to date. Now, we've said that even as we've recognized or acknowledged that there is real benefit or real immunity that many times we walk away from an infection with COVID-19 with. The problem is it's really hard to quantify that. And we know that there is some degree of variability with the kind of immunity any individual may get from any given infection. That variability is dramatically reduced when we talk about vaccination. The responses to vaccination are much more uniform, they're much more predictable, and we have just good proof in the pudding. Look at our hospitalizations. Who is ending up being hospitalized? Well, by and large, it's the unvaccinated. So thinking about it in very simple terms, our best advice is for people to get out there and get vaccinated and to give very serious consideration to a booster, particularly if they have an underlying health condition or are over the age of 40. Let me turn to my colleagues because they both work very actively with patients who have many questions about this. Dr. Gordon is an infectious disease doctor. Could you kick us off? And then maybe Dr. Bode, you could round it out as a pediatrician.
Well, thank you for that. No, I think it's a complicated issue. I think, as you said, surveys are out. But I would also say, to reemphasize, Omicron was so contagious and this virus spreads in households. I know the super spreader events get all the attention, but there was a fascinating study done in South Korea of Omicron. And Omicron's a little bit different as well in terms of its duration and interval for infection. But there was a 60% secondary attack rate amongst vaccinated households. Now, they didn't get sick. So I would submit that, we talk about individuals, but I look at this as the patient's household in terms of that level of protection. And this becomes a choice, as you said. We're not going to strong arm anybody. It's more about education, persuasion. In some cases, the horse is out of the barn. I mean, we all experienced in our families over the holidays, we all knew of family members where Omicron went through the parties and things of this nature. So I think there will be lessons learned, but in my mind now it's more of persuasion, and then again just keep continuing to go back to the well, and then being prepared for whatever the next respiratory viral issue is going to be.
Yeah, I'll just add that, anytime we've gotten a new vaccine approval for a different age group, we of course see the wave and demand of vaccination, right? That's very high over a period of weeks, and then that, wanes over time. But what we have seen is that we are still in all age groups consistently vaccinating new individuals that have now made the decision that they want the vaccine. And that's been slow and steady work. And that's the work that doctors do. So I would say, from a pediatrician's perspective, For me, that's about those one-on-one conversations, making sure that when families do have hesitancy, they have the opportunity to have that conversation. And again, not strong arming anyone, but answering their questions. And we are still seeing every week families making the choice to get their child vaccinated, and adults too. The other thing I would add is that we have to also remember that when we talk about equity and access, it's access to the vaccine, but it's also access to health information. And that's access to people that can impart that. So we have some people in our society that are surrounded by medical professionals. They've been talking about this every day since the pandemic started. And then we have, some people in our communities that don't really have that opportunity, relationship, access. And so we have to make those opportunities. And that's the work we do. And it's slow work and it's important work. And we're going to keep doing that week after week forever. That's what we do with vaccines. And I think it's important.
Our next question is from Courtney Francisco with WCPO.
Hey, can you talk to me a little bit about school districts choosing to make it mask optional now because the numbers are declining? Is it too soon, or what do you think?
Thanks. I think that's a great question. It's actually a really great follow-up from our opening comments during this press conference. Whether a school or a school district has a masking policy has been and remains a local decision here in Ohio. And it's one that we believe should be made in partnership with parents as well as teachers and local school leaders. And while we're grateful that as we look all across Ohio, we're now experiencing, in some circumstances, fairly steep and rapid drops in COVID-19 cases, we need to remember those statewide numbers that I shared. And we need to remember that, as we take the picture as a whole, we're still more than 5 times what is considered high levels of community spread. And there is no county that is below that high level threshold. So at this time, the Ohio Department of Health continues to urge Ohioans to protect themselves and think about using each and every tool that's available. Now, we continue to, of course, emphasize the importance of vaccination. And I'm going to sound a little bit like a broken record because we, as doctors, know how well vaccinations work, both for an individual and for communities. That's the key to really getting assured immunity against this thing. But we, of course, have other tools, and masking, keeping our distance, hand hygiene, good ventilation, avoiding crowds. These are all important tools that are available to us. So as we're looking at COVID, and it continues to evolve in our state, our perspective is that Ohioans need to make personal choices to protect themselves, their families, and their communities. And what we, as the Ohio Department of Health, will continue to do is we'll continue to promote what we think might be the best strategies for protection, and we'll continue to share data and information about cases and community spread and hospitalizations, all from the perspective of helping every Ohioan to make the best personal decisions they can about their individual health and well-being. And that includes the health and well-being of their children, their students in their communities.
Our next question is from Sara Shookman with WKYC.
Hi, Cleveland is getting ready next weekend to host the NBA All-Star Game, which is, of course, good news economically, and there's a lot of excitement around it. But city officials are also cautious about this people visiting from all over, and that could lead to an increase in cases. How closely are you guys watching that, and what advice do you have for those in Northeast Ohio?
Well, of course, we have a number of things that are working in our favor now from a timing point of view. Thankfully, Northeastern Ohio is leading the state in the rapid declines in Omicron-driven COVID-19 cases. And that's really a positive development. I'm really glad that that is happening, and that creates a local context that I think is helpful. Nationally, that picture is fairly similar. We're seeing rapid declines in so many parts of the country. And even those parts that aren't in rapid decline seem to be cresting, which is also encouraging. Having said that, you heard the numbers that I shared today. It remains the case that we're still at very high levels. We have high numbers of cases. They're improving, that's good, but they're still high. And so I think our recommendations will remain what they've been. We would strongly encourage people who are going into a crowded indoor environment to, whenever possible, be masking. We would strongly encourage people who are going to choose to attend that kind of event to make sure that they've been vaccinated and that their vaccine is up to date. Wash your hands. Be mindful of crowded situations. Can you find ways to avoid being in a more crowded situation? Now, obviously, if you're going into a large event, it is what it is. Your seat is where it is. But there are steps that you can take, and we would strongly encourage people to continue to take it seriously and take advantage of all of those opportunities. I don't know if my colleagues have anything that they would like to add. They may not, but I want to at least open up to Drs. Gordon and Bode to see if there's anything else.
Or Dr. Vanderhoff, I would agree. I think we are at a stage where it is about choice information. And we know the polling, we know that actually, paradoxically, the people that are boosted are still most concerned about acquisition or COVID, and the ones that never got vaccinated are the least concerned. So I think at this point, the only thing I'd emphasize is that CDC's come out now, not just about boosting, but about psychological health. And all of us are aware of that's probably going to be a lagging sequelae of the pandemic, whether it's about children's education, whether it's about anxiety, depression, and all the other things. So I do think we're reaching that balance, and people will come up with their own set point in decisions. And as Dr. Vanderhoff mentioned, I think it's just our duty as clinicians, ODA, to put that information out in front of our citizens, of our patients, and let them hopefully choose, educate it, and empower them.
Okay, our next question, and actually the final question today, will come from Laura Hancock with Cleveland.com, and the plain dealer Morella Porter with WKRC had to leave the call early. So Laura, you're next, and you're fine.
Hi, Dr. Vanderhoff. I was wondering, hi, good morning. Governor DeWine had said that the state was considering listing the difference between people hospitalized for COVID and people hospitalized with COVID. What is the status of that? Have you decided, and why or why not?
Yeah, thank you. So we actually have been in active dialogue with our partners in Ohio's hospitals to see what would be needed to gather that data and what impact having that information might offer us from a public health and a health decision-making perspective. And at this stage of the game, it appears to me that it would be very difficult to accurately get that data on a daily or timely basis. And the reason for it is this: when a patient comes in and their diagnoses are noted, there's actually very often at the beginning of a hospitalization, not as much clarity about what exactly is the root cause of a particular individual's illness or condition as there is later during the hospitalization. And so there can be a lot of change. The other mitigating fact is that if you're managing patients in a hospital, a patient who's admitted with COVID-19 or a patient admitted for treatment of a COVID-19 related illness, they still have to be put into situations that require additional resources. They can't share a room with a non-COVID positive patient. The staff still have to take extra steps and precautions. And so the resource burden on a hospital is really very similar, regardless of whether they're there with or for. So at this stage in the game, I don't think it's practicable for us to add that. And that's actually pretty typical of what we see in most states, most jurisdictions across the country.
Thank you to all of our guests today. Dr. Vanderhoff, do you have any closing remarks?
Well, I'll just close by again thanking my guests for their excellent input and sharing their experience as frontline physician leaders. I'd also thank the press for your continued interest in this pandemic and how it's impacting our state, and remind everyone that while things are improving, and no one could be happier about that than I am, we are still in a situation where the numbers are in the high range, and we need to continue using the tools that are available to us to protect our own personal health, as well as the health of those that we care about. So thank you all very much.
This concludes today's press conference. Thank you again for joining us.